Calluses, as we said earlier, are areas of hard skin on the bottoms of feet. You can see one because the patient had a Taylor's bunion. You can see one under the second metatarsal. You can see one under the first metatarsal, because people who have bunions usually get a callus on the side of the bunion and on the side of the big toe. And people who have Taylor's bunions usually get one right under the Taylor's bunion. There are two main classifications of calluses. One is the kind that you're seeing here and here and here, where it's just hard skin. But if you look closely at this one, see how there's a little core in the middle, that little white spot right there? These are excruciatingly painful. These are called porokeratomas. They are clogged sweat ducts. Okay? And when the patients come in with these, their chief complaint is usually they feel like they're walking on a nail. Many years ago, when I was still practicing in Chicago, I had a case of this when I was the 9th doctor on the case. And they were sending this poor woman to psychiatrists for psychosomatic pain because they said that nothing that small could be that painful. But once we fixed it and it no longer hurt, I guess they started believing. So what causes calluses to form? Again, bunions can cause them, Taylor's bunions can cause them, and another thing that can cause them is when the other metatarsal bones or the long bones of the foot are not in proper alignment. And what we're showing here in this diagram is the second metatarsal, which is the long bone right here. Notice how it's down lower in the plane than the rest of the bones. So rather than bearing 1/5 of the weight, this bone is bearing significantly more weight. And the way that the body tries to protect that is by building up a callus. So when patients go to pedicurists or even podiatrists and they get their calluses trimmed, it does nothing to stop them from ever coming back again. In fact, there's a good argument to be made that it makes them worse. So how can calluses be cured? Well, we know that if we correct a patient's bunion, that callus is going to disappear. We know if we correct the Taylor's bunion, that will disappear. If the patient has the special type of callus that we're discussing here with the porokeratoma in it, two procedures are necessary. First, to actually elevate this bone so that all the metatarsals are in the same plane, if you will. And secondly, we use a laser to remove the clogged sweat duct. And doing those two procedures is usually enough to stop this from ever coming back again. And I think we have an example right here. So this is a patient that came to me that had a very painful callus right here. And it was very clear that the reason for the callus was what we call a plantar flexion, or a downward direction of the second metatarsal. I never touched the bottom of this patient's foot. Through the top of her foot, I made a little cut in the metatarsal and I elevated the bone, and look what happened to the callus. Gone. Never came back again.